but he is the president of the Royal College of General Practitioners. It's a real honour. It's Professor Mayur Lakhani.
Thank you very much. It's very kind. Thank you. Good morning, everyone. And Sam, thank you very much for that generous introduction. Let me begin by saying a few things about our college. We're the largest medical Royal College in the United Kingdom. We have 53,000 members. We're the standard-setting body for general practice. We have 32 regional offices. We have 37 international programs. We have a turnover of £56 million, and we are embarking on a major transformation, working on the future of general practice and primary care, which I will speak about in a minute, and supporting members. We have reached many milestones, including this wonderful auditorium and building that you're in today. We also reached another milestone recently, and I think you'll really like this. We have 50,000 Twitter followers. And that's especially good because it's more than the Royal College of Surgeons. And more than the Royal College of Physicians, both of whom tried to stop the founding of the Royal College of GPs in 1952. But now they rent space out from us. Of course, we charge them extra, but actually no, in the spirit of integration, they're actually our best friends. So, and let me also say thank you to everyone here who's working in our health and care sector. You're working very hard in difficult circumstances in a under-resourced and essentially broken system of care. But day in, day out, you deliver great support for patients. So for those of you who are GPs and working in primary care, let me say 1 million people will visit their GP practice every working day. 1 million patients. 90% of the work of the NHS is done in primary care with 10% of the resources. For every full-time GP equivalent, 4.7 lives are saved every year through the public health impact. When you check somebody's blood pressure, although they've come in with a sore toe because they haven't had a BP check. But just think of the potential if we embrace the broader agenda and the wider determinants of health. 1/3 of practices are involved in research. 40% of practices are involved in teaching tomorrow's doctors. This is a thriving profession that's developing, and we're seeing the green shoots of recovery in general practice, primary care, and the NHS. But we are not satisfied with that because we have more work to do. Our goals are greater than what we've achieved. We know there are marked health inequalities, that the model of care is too biomedical. We need to embrace prevention and holistic care. So we've done a future vision of general practice, and let me just briefly describe the 3-part model of the future vision of general practice. The role of the GP as the expert medical generalist, the GP physician, the consultant physician of yesteryear, the most important doctor, the most influential doctor in health and care for their patients. And actually consultants want that to happen. First amongst equals, the GP primus inter pares. But working with a multidisciplinary team, not just of nurses and health visitors, but paramedics, pharmacists, the broader team providing great care to patients. But that's not enough. You have to understand what your role is. No man is an island. You're part of a connected system of care that's called the healthcare ecosystem. Let me tell you more about that concept. You're a physician or a nurse or a therapist. You're working part of a practice. The practice is part of a federation. The federation is part of a community network. The community network is part of a locality. The locality is part of an integrated care system. Good care depends on all those dots being joined up, including well-being. At the moment, those dots are not joined up. Don Berwick said, do not say, what do I do, but what am I part of? What are you part of? No man is an island. And Atul Gawande said, this is the century of the system. So you can see the connections being made. So as part of our work, we've identified 4 trends that I think will be irresistible. We call them mega trends. They will not go away. They are already assuming massive force, a momentum that will be unstoppable. The first one is people power. Citizens are dissatisfied with the offer of health and care to them. And with good reason, I may say so, for reasons we've already heard. Too much medicine, too much prescribing, where it's not appropriate. People power will be a force to be reckoned with. Second one, a new model of care that will be based on prevention, industrial scale prevention, holistic approach to health, with people taking charge of their own health and well-being. This is irresistible. The wider determinants of health, we've only paid lip service to that. It's not only the role of doctors, nurses, dentists. It's a broader society. The third trend is the power of technology, innovation, artificial intelligence, digital. And finally, genomics. People are already having their genes tested to 23andMe. The NHS, I'm proud to say, is one of the largest genomic programs in the world. Our college is instrumental in leading the way because the future of medicine will be about genomics, and we want GPs to lead that way. Ladies and gentlemen, these are the 4 new frontiers in health and well-being. People power, prevention, digital, and genomics. So let's fast forward to perhaps 10 years. And I'm influenced by 2 reports, Beyond the Fog, which was commissioned by the Royal Free Charity, and a book that I'm reading at the moment called Deep Medicine by Eric Topol. He's one of America's top doctors and cardiologists. He also wrote a very famous book called The Patient Will See You Now, Doctor. He has written another famous book now. So let me tell you about Lisa. Lisa is in her mid-50s, she has type 2 diabetes, and she has fatty liver disease. She gets up one morning, and Alexa says to her, "Good morning, Lisa. Your numbers this week are not so good. Your sugars are high because there's continuous monitoring through wearables, sensors, and dots. We notice also that you're not on target with your exercise. Your mood's been a bit down, and I'm not happy about what's happening." And she said, "Oh, Alexa, what shall we do?" She goes to the bathroom. She looks in the mirror, and the mirror detects the bilirubin levels in her sclera automatically. And she has a mole on her cheek, which is being measured and continually monitored, and fed to Watson, which is a great artificial intelligence bot that's collecting all this data. And Alexa notes the sad faces, perhaps the round faces, perhaps the thinning of the eyebrows, maybe early hypothyroidism, because she's gaining weight, and her weight is recorded automatically. She uses the bathroom, and then the red light on the mirror flashes because proteinuria has been detected automatically. And Alexa makes an appointment automatically with the GP through the NHS app because it's all connected. It's all connected. So Alexa then says to patient, "What shall we do now?" And says, "Well, I'll do my shopping now." So she's got online shopping with Asda, and you know what she's ordering? White rice. Do we think that's a good idea? No. So Alexa nudges her and gives her advice, saying, "I don't think that's a good idea." So she goes for potatoes. Do we think that's a good idea? No. Then she said, "What about pasta?" And she says, "I'll go for some fruit." And you know what she's thinking of ordering, David? Bananas. And what do we think of that? Okay. So, The consultation takes place with the doctor. Now the doctor, imagine, Topol said, imagine if you had all the information and decision support and artificial intelligence before you see the patient. It can help you be more human and compassionate. Artificial intelligence is not the enemy of the doctor-patient relationship. It's a support because you have all that information. So instead of spending 12 minutes collecting data and information, you spend 12 minutes of a 15-minute consultation, which is our college's ideal, talking and interacting with patients, discussing their ideas, concerns, and expectations. So you go in, and before the patient comes in, you already have the information because the patient has had the genomic testing done. She's got PALB2 gene mutation. She's at higher risk of cancer. The proteinuria suggests she should be on an ACE inhibitor. There's masses of information and risk assessment. The doctor is comfortable with him because they're a well-trained GP through the Royal College of GPs. So they have a discussion, they have an interaction, and you can see how the genotype, the phenotype, the patient's lifestyle and exercise, their environment, their city, through mega data is all connected. All singing, all dancing. Always on, not episodic, because our current model is episodic and based on symptoms. This is always on, technology enabled. People, well-being, and health and social care with early diagnosis. So they have their discussion, and as Alexa is there listening and is also giving the doctor advice, you're missing some cues here, you know. So the patient leaves, goes to the door, and as they turn the handle, they turn around and say to the doctor, "While I'm here, doctor." And the doctor, because they've been well trained, again by the RCGP, recognizes that's probably the most significant thing the patient's saying. Ask them to come back. They sit on the chair and they start crying because their husband, their marriage is breaking up. You still need that interaction. So ladies and gentlemen, these are the irresistible frontiers, the new frontiers of health and well-being. So to end with, I want us to think through what this means for us. Because we are in a volatile world, in an uncertain world, a complex world, and an ambiguous world, otherwise called the VUCA world. And what we need to do is to have leadership. We can navigate this uncertain and ambiguous world, but we have to embrace care and compassion with technology and genomics. And I offer you the shield of the college with our motto, Cum Santia Caritas, which actually is caring with compassion and science. And the shield has on it the owl, which is for wisdom, thinking, and learning. It has a gavel, which used to mean authority of doctors. Now I think it means justice and leadership. It has the lamp of learning, which means scholarship, research. And I would urge you all to think of evaluation, of ethics, of governance, of rational debate, rational discourse in science. I think it's unhelpful to take extreme positions or adopt tribalistic behavior. But actually we will be advanced through evidence-based public policy and scientific decision-making. So I would say to you now, please adopt the 3-point President's Action Plan. Even if you're not a GP, I think this can apply to you in terms of managing the VUCA world, because we want those great outcomes, don't we? So first, be the best doctor you can be. It's all about standards, and it's all about learning and people development. You will need to interpret what that means for you. Secondly, be on the side of patients and communities. People who are overlooked, who are bypassed. Members who are overlooked and bypassed. I want everyone to flourish and every community to flourish. And finally, shape the future, because through leadership, and I'll finish on this note, through leadership we can embrace the new frontiers of health and well-being. Thank you.